This is ID number 245, a research study entitled An Integrated Decision-Making Model in Building and Expanding Health Facilities by authors Marvin Noroña and Katherine Gavino from Mapua University, Manila, Philippines.
In the past decades, the healthcare environment received much attention in the research world in solving various problems such as scheduling problems, appointment system problems, medical resource planning and reallocation problems, hospital capacity problems, and emergency medical service problems, to name a few. In most of these studies, there have been fruitful efforts in developing solutions to these problems that made use of demand forecasting, simulation, and optimization modeling approaches. However, studies regarding the use of these modeling approaches are not widely known and limited in the Philippine setting. The fundamental goal of the Philippines government in the health system is improving the access of health services for every Filipino. But in a study carried out by Lavado in 2010, the Philippine healthcare delivery system has been in general somewhat operationally inefficient, as it is consisting of health facilities spread unevenly across the archipelago, which resulted to high costs, long waiting time for patients, and low technical performance levels. In another health system review written by Romualdez in 2011, it described the distribution of health facilities across the country in a way that there was too much infrastructure in some area and too little in others without any real logical pattern. Unfortunately, there is also a dearth of studies that develop a model to examine the healthcare delivery system in the said country.
With this in mind, this research aims to know the factors that have a significant effect in building and expanding health facilities and to develop an integrated model that will make use of demand forecasting, simulation, and optimization modeling approaches. A research conducted in Mapua University motivated the theoretical framework of this study. It used a compressed framework in parts optimization and integration in the Philippines. The said compressed framework was altered for the purpose of this study, and that is for the healthcare sector specifically and building and expanding healthcare facilities.
The conceptual framework showed how the different approaches have been integrated into this study and was broken down on the expected results of the assessment, forecasting, simulation, and optimization modeling approaches. The framework considered major factors, namely geographic, market and economic, social, physical development, operations, and human resources related.
Factors mentioned were the potential forces that can influence the health workers, health resources, and patients in a certain healthcare facility. It served as a guide concerning the trend and growth of demand in a city or a province.
The following operational framework showed how the concept discussed was conducted. In this study, the researcher reviewed and consolidated various articles or journals related to the subject to include all the factors identified that could help in the formulation of the integrated model. In addition, primary and secondary data were used to collect data. The primary data were the information requested from the main office of the Department of Health, and the factors collected from related sources were then evaluated using a survey questionnaire, and this served as a secondary data. For this study, respondents came from the decision makers comprising of Department of Health representatives, Provincial Government of Laguna, and private hospital administrators. Respondents also came from the medical professionals and the community. The questionnaire was in the form of a 5-point Likert scale, enabling the respondent to select an option that best supports their opinion by assessing each factor according to the subject matter under study, from 1 not at all important to 5 very important. After the data collection, several statistical analysis tools were used. Once the significant factors were identified, a summary was presented to show how they were considered in the integrated model. Analysis of variance, or ANOVA, was used to scrutinize whether there is a statistically significant difference between the group means. Results showed there is no significant difference in the gathered responses of the different target groups. Multiple regression analysis was used to test whether the characteristics of the target groups have a significant effect on each variable. Results showed that the demographics of the different target groups do not have any significant effect on the factors except for one. The table as shown contained the results of the Pearson correlation coefficient and the two-tailed p-value that focus on the strength of the factors' relationship with each other. As seen, the factors have positive correlation with strength ranging from weak to strong. Results showed one pair with a strong positive correlation ranging from 0.8 to 1, which was between the operations-related factors and the human resources-related factors. Lastly, factor analysis was used to simplify the data by reducing many factors into a fewer number of significant dimensions. The original structure of 88 sub-factors is reduced to 60 sub-factors. And this figure reveals the integrated decision-making model in building and expanding health facilities. The volume drivers are categorized into geographic, market and economy, and social factors. These external factors influence the movement of the health resources and patients in a certain health facility. The health resources parameters are grouped into 7 as they have different data types: hospital bed, medicines, medical equipment, medical goods, support, health workers, and functional workers. The purpose of these parameters is to know whether a certain number of patients can be accommodated in a certain health facility at a time, given certain constraints. Finally, the health facility requirements, which are usually predetermined by governing authorities or bodies. These requirements are essential for all phases of the study as they will have an impact if the operations will run smoothly in the short and long run.
Future researchers can concentrate on discovering the appropriate tools or methods for each stage or phase in the decision-making model through an in-depth analysis. Moreover, experts from the IT field can also come up with a software or a computerized system that can handle the logic of the said model as well as the large volume of data incorporated in it. Again, this is ID number 245 from Mapua University, Manila, Philippines. Thank you for listening and have a nice day.